Thanks for being here, everyone. We have a new member on the checklist implementation team, Seth Powell, one of our scrub techs. So I'd like to share a little background about what we've been doing. A month ago, Dr. Lopez told us about a surgical patient safety checklist they're doing at another center where he operates. He thought that would be something we would like to have here. We've been looking at the types of checklists other centers use, and we've taken the best of everything we found and made a checklist for our center.
Before we start using the checklist in the OR, we want to make sure that it fits the flow of our center. Today, we thought we could run a tabletop simulation where we go through the checklist line by line to see if it works. Now, previously, we've used tabletop simulations to improve tools before using them with our patients.
Sounds like a good idea. I've done one of those simulation exercises before, and it's pretty helpful.
Are you saying we're going to pretend this is the OR and act this out?
That's exactly what I'm saying. We need to imagine that this is the OR with a real patient. We will walk through the process of using the checklist, and if something doesn't work, we'll modify it as we go. So, here's the checklist we created. We tried to make it fit all of the different procedures that we perform here. The checklist is in two parts, and I'd like for us to read through the pre-op section first. We need to imagine we're in the pre-op area with the patient. For the second part, we'll need to imagine we're in the OR right before the incision. Now, does that sound reasonable to everyone?
I haven't done this before, but it sounds good.
Okay, let's get started. Let's make up a patient. Rusty Smith. Yes? Yeah. Date of birth?
1189.
Oh, okay. Procedure to be performed?
Let's do a right inguinal hernia repair.
Okay. Okay. We'll pretend this is our OR table, and over there will be our pre-op area. Joe, would you be willing to be our patient?
Sure.
Okay. Let's imagine Joe is in the pre-op area there, and we'll go through the checklist.
Then we'll bring him over here and we'll put him on the table to prepare him before the skin incision.
You mean actually on the table?
We want to make this realistic, don't we?
We do. I'm in.
Okay, Joe, I need you to come right over here and be Rusty Smith right there. Hi, Mr. Smith. My name is Mindy, and I'm your nurse. This is Michelle Lynn, and she will be your nurse anesthetist.
It's nice to meet you.
Hi, Mr. Smith. It's nice to meet you, too. We're going to go over some safety checks with you before we go into the OR, okay?
Okay.
Can you start by telling me your name and date of birth?
I'm Rusty Smith, and I was born, 1/1/89.
Did you say January 1st, 1989?
Yes, that's correct.
Mr. Smith, can you show me where you're having your surgery?
Okay, the OR is ready.
We're ready. Are you ready to head back into the OR, Mr. Smith?
Ready.
Let's head to the OR.
Okay, let's stop here and assess what needs to happen next. After the pre-op stage, the next part of our simulation is where we bring Mr. Smith into the OR where he'll be prepped and we can position him.
So now you want me to move to that part of the table?
Yes.
Yeah, let's go. Okay, let's start our timeout. Is everybody ready?
Yes.
All right, team, let's introduce ourselves. I'm Dr. Lopez, and I'm the surgeon doing Mr. Smith's inguinal hernia repair.
I'm Mindy, and I'm the circulating nurse.
I'm Michelle, and I'm the nurse anesthetist.
I'm Seth. I'm the scrub tech.
All right, now that we've introduced ourselves, let's talk about the patient. We'll be doing a hernia repair on Mr. Rusty Smith. The site is on the right side. Mindy, does that match the information on your consent and checklist?
Yes, it does. Okay, Joe, you can get off the table now.
I thought you'd never ask.